going to simulate that we are in the hospital setting. Of course we are not, but if this were the hospital setting, I would walk in and go ahead and wash my hands. So I'm going to simulate washing my hands. And then I'm going to introduce myself to the patient, tell her my name is Sally, I'll be your nurse today, and today I'm going to be conducting a head-to-toe physical assessment. The first thing I'm going to do is check the patient's ID band, and then to verify that the information is correct, I'm going to go ahead and ask her what her name and date of birth is.
Becky Mitchell, 1/24/94.
Okay, so the next thing I'm going to do is assess her posture, and she is erect, her head, neck, shoulders, and back are all aligned whenever she is sitting. Her mood is normal, her affect is normal, and next thing I'm going to do is I'm going to assess her level of orientation. So again, I'm going to ask her what her name is,
Becky Mitchell,
what today's date is,
November 20th.
okay, and I'm going to ask her where she is today,
The hospital,
and why she's here.
for my yearly physical.
Okay, so patient answered all those questions correctly, so I'll go ahead and document that she's alert and oriented times 4. So the next thing I'm going to do is talk to her about her hearing. So that would test cranial nerve 8. Patient has been able to respond to me every question that I've asked without mishearing me or asking me to repeat myself, so I document that cranial nerve 8 is intact. The next thing I would do is ask her to speak to me. Since she's already told me a few things, I would go ahead and document that cranial nerve 12 is intact because she is able to enunciate her words, and that cranial nerve 10, which is guttural sounds K and G, she can say both of those, as we heard by her saying her name, are intact, so cranial nerve 10 is intact. Next, I'm going to assess the patient's vital signs, so I would ask her what her height and weight are, and then we're going to go ahead and take her temperature, her blood pressure, and her pulse. So I'm going to start out with her blood pressure. And while we're getting this ready, I'm going to go ahead and ask her to tell me what her height and weight is.
5'4", 130 pounds.
So normally with a patient who has a sweater on of this size, I would ask them to take it off, but for today's purpose, we're going to leave it on. Now, any baggy clothing or heavy clothing that a patient wears in the wintertime can affect the patient's blood pressure. So you would always want to take that into account whenever measuring. So I'm going to go ahead and put on my stethoscope while supporting my patient's arm. And I'm going to ask her to uncross her legs, as I know that that can also affect the patient's blood pressure. Uncross your legs for me. So I'm going to go ahead and do the 2-step blood pressure. And I'll step to the side so you can see. Okay, and I felt the blood pressure stop at 60, so I'd pump it up 20 to 30 millimeters hydrodiaphragm above that, and then listen. Blood pressure reads 110/64, which I would then let her know is normal for her age. So her blood pressure is age appropriate. The next thing I'm going to do is go ahead and take her temperature. Temperature is fairly easy. You just insert the thermometer and make sure that the patient knows that it should be below her tongue. At the same time, I could assess her radial pulse, so I'm going to go ahead and do that now. which is within the normal range for an adult between 60 and 100. So I would let her know that that is normal for her. Her temperature is 98.7, which is also normal. So I would go ahead and document my findings there, and the next thing that I'm going to do is assess whether or not my patient can see. Since she was able to walk into the room and sit down on her own without missing the chair, running into any walls or anything like that, I would go ahead and document that cranial nerve 2 is intact. The next thing I would do is talk to her about pain. I would ask the patient if she is experiencing any pain right now.
No.
If the patient were to say that she was experiencing pain, I would then ask her where, as well as go through Old Cart's ICE to properly evaluate that. The next thing I'm going to ask her to do is we're going to talk about her hands and her fingernails. So what I'm going to get her to do is hold her hands out like this. And I'm going to make sure that both of her hands are symmetric, which they are. And then as well, I'm going to inspect the skin surface characteristics, the temperature, which is nice and warm. Her fingernails are clean, which denotes proper hygiene, as well as her nail beds are at 160 degrees. So that would eliminate spoon or clubbing of the fingernails. And so I would go ahead and document that as normal. The next thing we're going to do is we are going to palpate her skull. First, I'm going to look at it for any abnormalities, and as far as I can see, there are none, but patient does have a full head of hair. So I would also look at the hair of the patient and look at uniformity of color and texture and see if she practices good hygiene. So to assess texture, I would go ahead and roll a few strands through my fingers to make sure it's not brittle, which it isn't, and then I would notate that the hair is uniform throughout and proper color for the patient's ethnicity. So the next thing I'm going to do is palpate her skull and make sure that there are no lumps or deformities, as well as impaired skin integrity. Now, if we were in the actual hospital setting and my patient was laying down for long periods of time, we would go ahead and braid her hair if that was okay with her. Other than that, we would make sure that we assess the back portion of the patient's head to make sure that there's no impaired skin integrity from laying on it. Now, if we were in that setting, I would of course put on gloves before I palpate the patient's head. As of now, I'm going to go ahead and do that right now. And let me know if there's any pain or tenderness anywhere. Okay, patient denies any pain or tenderness, so I would denote that as normal. The next thing I'm going to do is I'm going to assess her temporal pulse, which is right in front of the ears. So I'm going to go ahead and press lightly. And is that uncomfortable for you? Okay, good. So I would document that as normal as well. The next thing we're going to do is I'm going to assess her facial cranial nerve, which is cranial nerve 7, and by doing that, I'm going to look at the symmetry of the patient's face. So what I'm going to do is I'm going to ask her to smile and then frown. Okay, so patient's face is symmetrical. There's no drooping or disfiguration of the face, so I would also document that as normal. And the next thing I'm going to do is I'm going to ask the patient, I'm going to tell her that I'm going to palpate her maxillary and frontal sinuses. So that is going to require me to touch her face. So once I get the okay from my patient, I'm going to palpate on the lower aspect of her forehead, right above the bridge of her nose and eyebrows, and ask her if she feels any tenderness there. And then again on the side of the nose, any tenderness there? Okay, so I'll document that the maxillary and frontal sinuses are normal. Next, we're going to talk about the temporal and masseter muscles, which assist you in chewing. It is the trigeminal cranial nerve, so we're going to assess mass and strength. What I'm going to do is I'm going to place my fingers on the temporal joint, and I'm going to ask her to chew or clench her jaws as tightly as she can. Okay, and then again on her masseter muscle. Okay, so she has equal strength on both sides, and it was noticeable. There was no faint bulging of muscles, so I would document that as a normal finding. Next thing we're going to do is touch. So I am going to ask her to close her eyes in order to test the sensory portion of cranial nerve 5. And what I'm going to do after I ask her to close her eyes is I'm going to touch her on a part of her face and then I'm going to ask her to tell me where I've touched. So I'll touch the portion of the face and she'll point to it to make sure that that her sensory portion is intact. So go ahead and close your eyes. And then point to where I've touched you. And now we're going to do it one more time. And point. So I would document that the sensory portion is intact because she is able to feel light touches. Next thing I'm going to do is palpate her temporal artery and all of her lymph nodes. So temporal artery, we're going to palpate that. And then we're going to do the lymph nodes. So you would palpate each one of them bilaterally. So we are going to start with the preauricular, and let me know if you feel any tenderness throughout. And then we have the postauricular, the parotid, the sternomastoid, the occipital, and then we have the tonsillar, the submandibular, the submasseter, sublingual, the anterior superficial cervical chain, the deep cervical chain, the posterior superficial cervical chain, and the supraclavicular. So did you feel any uncomfortable on any of those lymph nodes? She denies any discomfort, so I would document that as normal. So the next thing I would do is I'm going to go ahead and inspect her neck and trachea for symmetry. Just inspecting it, it looks good, so now I'm going to go ahead and palpate the trachea and ask if she has any discomfort. Trachea is midline and slightly movable. Now I'm going to go ahead and ask her to swallow. Okay, she possesses swallowing capability, so I would document cranial nerve 9 and 10 as intact. Now what I'm going to get her to do is to move her head forward, and then back, and then to the right shoulder, and then to the left shoulder. Okay. So did you experience any discomfort with that? No? So what I'm going to get you to do now is to hold your shoulders up like this, and I'm going to try to push down, resist the urge. Okay. So she did good on that, so I would document that cranial nerve 11 is intact. Now we are going to do her carotid arteries. So what I'm going to do is I'm going to go ahead and palpate one at a time, the carotid artery, and make sure I can feel a pulse. Okay. Bilaterally, I can feel a pulse. It is neither weak or thready or bounding, so I would document that as a normal finding. And next, I'm going to go ahead and auscultate each carotid pulse. Again, each carotid pulse is heard bilaterally, and it is neither weak or thready or bounding, so I document that as normal. It is a steady, normal, rhythmic heartbeat. Next, I'm going to ask her to look slightly to the right, towards her right shoulder, and then kind of tilt your head just a little bit. Okay. And this is going to be to assess jugular vein distension and see if I can see a pulsation. In some patients, you will not find one, but hers is very slightly showing. So that is a normal finding if you do find it, but then again, as I said, not everyone will see it. So next I'm going to ask the patient if she has any eye problems. Do you wear glasses or contacts? She does not. So for this portion, we do not have to do the Snellen test, but what I am going to do is inspect her eyebrows, the eyebrow hair distribution, and the skin under the eyebrows, which is all normal, and she does not have any lesions or sores on the underlying skin of the eyebrows. Next, I'm going to inspect her eyelids, eyelashes, the palpebral fissure, and her ability to blink. So first of all, I'm going to ask you to blink. And when she does that, her eye does close completely. So next, I'm going to ask her to close her eyes fully, so I'm going to inspect the eyelids. Make sure that we don't have any deformities there. We do not. The skin is intact and uniform throughout. So I would document that as a normal finding, and since she was able to blink, I would say that cranial nerve 8 is intact. So next I'm going to inspect the actual eyeball, as well as the sclera, iris, pupils, the corneal transparency, the color, shape, and clarity. So I'm going to go ahead and ask you to open your eyes. Okay. Color is the same on each. We have uniformity throughout. The cornea is transparent. The iris is of appropriate size. So now I'm going to do the cardinal field of vision. What I'm going to ask the patient to do is follow my finger, and I'll step to the side so that the video camera can see it. So you're going to follow me out and back in each time. Okay, patient was able to follow my fingers with no problem, so I document that as a normal findings. And the next thing I'm going to do is test the specific cranial nerves 3, 4, and 6. So to test 3, I'm going to have her follow the tip of my finger straight up and then obliquely and inward. So that would almost be like her crossing her eyes. And then we're going to go to the left side and then right side. Okay. So cranial nerves 3, 4, and 6 would be documented as intact. Now I'm going to test her pupils. So the first thing I'm going to do is pupillary constriction. So I'm going to shine my pen light into the right eye and make sure that the left pupil dilates for constriction. Okay, and it does, so I would document that as a normal finding. The next thing I'm going to go ahead and do is put on my gloves, and I'm going to assess the patient's ear, make sure that they are symmetrical on both sides of the head, that the pinna lines up with the outer pampus of the eye. So the first thing I'm going to do is go ahead and measure that. So I would just follow in, and we do, so it is symmetrical on both sides. Each ear is the same shape, and they are normal size for the patient. So next I'm going to inspect the outer ear for any sores, lesion, or discharge, of which I find none. And then I'm going to palpate the tragus and the auricle. Do you find any discomfort there? So patient says she does not find any discomfort. So I will document that as a normal finding as well. I'm going to discard my gloves and carry on. Next, I'm going to talk to the patient about her sense of smell. I'm going to ask her if she's had any trouble with that. Are you able to smell properly? Okay, so that would deem cranial nerve 1 as intact. So next, what I'm going to do is I'm going to inspect the patient's nose, septum, for symmetry, and we're going to see if her nostril is patent on both sides. So I'm going to ask her to tilt her head slightly back, and then I'm going to look in both nostrils. They are proper color, okay? Both are patent. So I document that as normal finding. Next, we're going to talk about the patient's, if there has been any discharge from the patient's nose, as that would indicate that the that the turbinates are not properly working. So I would go ahead and ask her, have you had any discharge? Okay, she does not, so I would document that as a normal finding and that the turbinates are working correctly. Next, we're going to talk about cranial nerve 7, which is salty or sweet taste. Now, if she does say that she has any problems tasting either salty, sweet, sour, or bitter, we could do a taste test, which would be to place a small amount of each on her tongue and make sure that she can properly identify what it is. Same for smell. If she had said anything was giving her problems smelling, we could pass a few normal familiar smells under her nostrils to make sure that she was able to properly identify. So she did say that nothing was wrong with her taste. So that would document that cranial nerves number 7 and 9 were intact. Now we're going to inspect the lips, the oral mucosa, the gums, the salivary glands, and the teeth for number, consistency, size, shape, position, and just to make sure there are no general abnormalities. So I'm going to go ahead and put my gloves back on. So all I'm going to get you to do is open your mouth a little bit. And then I'm going to look at your teeth, which patient has all of her teeth. And then go ahead and stick out your tongue. Okay, open your mouth all the way. Okay, the tongue is of proper surface characteristics with slight bumps on the top. It is symmetrical and aligned midline. It is of proper color. It's a nice pink color. There are no sores or lesions inside the patient's mouth. The patient's teeth are the proper color for her ethnicity, and they are in the correct position. So we would document all of that as normal findings, as well as the lips and oral mucosa are the proper color for the patient. So next we would talk about the oropharynx. If there were any abnormalities whenever the patient opened her mouth, such as a sense of smell, we would document that and go ahead and relay that message to the physician. Since there were no odors in the oropharynx, then we would document that as normal. And then while I was looking down her throat, I assessed the anterior and posterior pillars, as well as the uvula, which is midline and is easily seen and not obstructed by the tonsils, which I did assess as well, and the tonsils are not swollen and of normal size. And then I looked at the posterior pharynx, but what I'm going to do is now I'm going to ask her to open her mouth once again and say ah. Okay, so I can properly see down the back of her throat and her posterior pharynx is intact. Saying I does assess cranial nerve number 10, which I would document as intact. And then as we talked about earlier with K and G, the guttural speech, that assesses cranial nerve 9, as well as the movement of the uvula and gagging. So next I would inspect the movement of her tongue. So I would ask her to stick it out completely, try to touch her nose, try to touch her chin, and then go from one side to the other. Okay, so that assesses cranial nerve number 12, and I would document that cranial nerve number 12 is intact. So next we're going to talk about the arms. So what I'm going to get the patient to do is hold her arms straight out like this, and then here, and then back out, all the way up and around, okay, and to the side, and then touch her shoulders again to assess range of motion. Patient did not express any discomfort as we went through those range of motion exercises, so I would document that as normal. But I'm going to go ahead and inspect the patient's arms for any lesions, sores, abnormalities, and I'm going to go ahead and palpate her elbow for deformities, as well as her wrist. Nothing on her wrist or elbows, and she does not say anything about discomfort, as well as the patient's arm, and I would do this bilaterally. So since we can go ahead and document that as no tenderness, no deformities, and that the temperature is of proper temperature, we could go ahead and denote that as normal. So next one I'm going to get the patient to do is I'm going to palpate her brachial pulse bilaterally. I was worried that I might not be able to feel it through the jacket, but I can. Okay, so I'm going to go ahead and test the other arm. It's of normal amplitude on both arms. I'm going to go ahead and slide this one up. I'm having a little bit of trouble feeling it. Okay. Okay. So it feels as if they are equal amplitude on both arms, so now I'm going to go ahead and I've already done her pulse on this arm, so I know that it's normal and has a nice rhythmic beat to it. So now I'm going to assess this radial pulse. It's rhythmic, even, is neither weak nor thready nor bounding. So we would assess brachial and radial pulses both as normal. So next we are going to talk about her upper extremity range of motions, as in her hands, arms, biceps, and triceps. We already did full range of motion by asking the patient to touch her shoulders and go all the way out. So what I'm going to get her to do is hold her hands out like this, and I'm going to try to push down and you resist. And now hold your hands like this, and I'm going to try to push up and resist, which is good. So now I'm going to ask her to pull her arms out to the side, and I'm holding down on her arm, and what I'm going to get her to do is try to pull up, okay? And then we're going to switch the other way. I'm going to try to push up, and she's going to resist, okay? So triceps and biceps muscles are intact, normal, and they are appropriate in mass and strength. So next what I'm going to do is we are going to move into the posterior chest. So we are going to look at the color. We're going to look for lesions, scars, any prior back surgery she's had might be an indicator of some back pain. So if we were in the hospital setting, I would ask the patient to replace her jacket with a gown. That way it would be open back and I could see all of it. Since we are not in the hospital setting, we are going to assume that I have assessed all these things. And next we are going to look at the posterior and lateral symmetry of the arms. So anterior, posterior, lateral diameter should be a 2-to-1 ratio. And judging from, okay, I would say that it is a 2-to-1 ratio. If you felt that it might be close, you could get out a ruler and actually measure that. So next what we're going to do is I'm going to ask the patient to go ahead and stand up. And I'm going to look at the alignment of her spine, which is good. And then I'm going to ask her to go ahead and touch her toes. So this assesses a few things, including scoliosis. So go ahead and touch the toes.